The all mankind is from Adam and Eve. The women are the most beautiful creation of Almighty and the only creation that leads to further creation. The story of Eve and the daughters have always remained enigmatic in the pages of history. We saw the civilizations who worshipped women and then the civilizations who ripped the woman in pieces. However, it is matter of fact that all the Semitic and the non-Semitic religions had common agreement on the protection, care, dignity, and respect for women. The beautiful saying that goes, "Be respectful to women, for they are the mothers of mankind." We witnessed the rise and fall of women in the history of human being. We witnessed the rise of Roman Empire with Cleopatra and Julius Caesar, and we also witnessed the powerful wife of Pharaoh's queen, Hinhineth, dying of VVF due to obstetrical trauma. We witnessed the Jesus as Messiah for the sufferers of outcast in a society of leprosy and blindness. We witnessed the glory of Queen of Sheba, also called Bilqis, and Prophet Solomon. We witnessed the memorable impacts of Mary, Sarah, Veronica, Hazrat Khatija, Hazrat Aisha, Hazrat Fatima, and the unmatchable resilience of Hazrat Zainab against tyranny. We witnessed our holy Prophet Muhammad sallallahu alaihi wasallam preaching for the social, legal, moral, and legitimate rights of women in a society that was known for burying the newborn daughters and brutally killing women over feudal disputes. Women are like flowers that should be treated gently, kindly, and with affection. In the heart of Pakistan, amid its rich tapestry of culture and tradition, there exists a silent struggle affecting a significant number of women. This is the story of urinary incontinence, a condition that transcends the borders and impacts lives in profound ways. It is a story that deserves to be heard and understood. The complaint of unintentional urine loss is known as urinary incontinence, or UI. Although it affects both sexes equally, UI is more prevalent in women. The World Health Organization has designated it as a priority. The influence of urinary incontinence on the physical, social, mental, and the economic elements is a cause of concern, and the burden associated with it is significant on the local, national, and international scale. However, there are several barriers in terms of knowledge and attitude towards seeking health care among women experiencing UI.
When if we move towards the prevalence of the different types of incontinence, according to the WHO, in 2023, around 1 million females were suffering from the vagina fistula that were mainly because of the obstructed labor and partly also because of the other gynecological problems. About 2 million females are unfortunately living with these untreated fistulas in Africa and parts of Asia. In parallel to this, in UK and developed countries, the prevalence is going downwards and it's about 0.5%. But unfortunately, in Pakistan, we don't have any documented data regarding this.
Women suffer in silence due to the lack of awareness or the societal stigma. It is important for our healthcare professionals to educate women about the treatment options and provide support for those affected by UI. Pakistan, a male-dominated society, often overlooks women's health issues due to the limited access to primary health care and the lack of female doctors in rural areas. Unfortunately, women of Pakistan face many health issues, ranging from high mortality rates to a growing number of breast cancer cases. The government's neglect of enhancing the primary healthcare system in Pakistan further exacerbate the problem. Cultural norms also contribute to women's health being disregarded here, especially in the rural areas. A UN assessment shows that 48% of Pakistani women lack voice in matters pertaining to their own health. Memfaiza Hayat, a consultant urologist at IKD, who was selected by the International Continence Society as one of the 5 urologists around the world. She represented Pakistan and performed abdominal and vaginal VVF surgeries on patients in Zambia, Africa, tells us that the sensitivity and the stigma attached to the condition often leads to hiding and resistance towards disclosing the problem and seeking a remedy.
The population of Pakistan comprises of 45% of females, which is almost equal to the male population. And female do face urological issues regarding UTIs, pelvic organ prolapse, stress incontinence, and overactive bladder. But most of our females keep on delaying their illnesses until they present to us with complications. And then those complications are a bit challenging to treat and they might require surgical intervention.
More than a quarter of women had complained of UI for more than 5 years. Only a small percentage of individuals receive effective treatment among those who are accurately diagnosed. Treatment options for stress, urinary incontinence, and overactive bladder in women are designed to prevent the involuntary loss of urine from urethra. Therapies include behavioral therapy, that is, bladder training, fluid and dietary modification, and drug therapy with anticholinergic medications. Surgical therapy for this condition has well existed over 100 years, but because of the physiological risks that inherent in the surgical procedure, surgeons continue to modify their techniques to improve efficacy.
If someone is performing the pelvic surgery, just catheterize the patient. A decompressed, catheterized bladder save itself from any sort of the iatrogenic injury. Number two, if you are operating upon a difficult like hysterectomy, redo hysterectomy, a very big fibroid, better to have stent, put a DJ stent, or the urologist will put the DJ stent in, or a ureteric catheter in, which will help in the identification of the ureter peroperatively, and that will save the ureter for any iatrogenic trauma.
UI leads to psychological distress, significant weakness, social seclusion, and increased economic burden on the country. This has led to a poor quality of life among our women. A widespread misperception exists in the general public and the healthcare professionals that incontinence is a normal consequence of childbearing or aging.
पेशावर की और बीमार भी बहुत ज़्यादा थी और मेरे मस्ताने में भी तकलीफ थी, पेशाब निकल जाता था और बहुत ज़्यादा मैंने इलाज भी करवाए लेकिन कोई फ़र्क मुझे पड़ा नहीं है। और मैं यहाँ आई हूँ अल्लाह का शुक्र है कि इंजेक्शन वगैरह लगाए तो अभी मैं ठीक हूँ। तो इस वजह से जो है ना जख्म का मसला था, अभी मैं ठीक हूँ, बीमार में जब कर लेती हूँ और खाना पीना भी ठीक है, मेरे मसाले भी अच्छा हो गए।
Women with urinary incontinence or UI, they should be screened annually, educated about the risk factors, the symptoms and the complications, the coping behaviors, and referred for further evaluation and treatment. Mass awareness campaigns, support groups, and ongoing medical help can also help us break the stigma surrounding urinary incontinence. During the preparation of this wonderful workshop, we came across the stories of a myriad of women. A poor woman with VVF who was successfully operated by Professor Dr. Liaquat Ali after living in misery for 20 years in a barn. We cried instantly listening to this poor mother's story, whose daughter died of kerosene oil poisoning for induction of labor by a traditional birth attendant just because they didn't have ghee at home. We learned that the etiology of female urinary incontinence is different for different parts of the world. It's different for the nations who practice modern primary healthcare and obstetrical protocols versus the nation who still believe in the saga of traditional birth attendants. These incontinent women are considered as an outcast of the society, the ashamed, the divorced, and the forgotten. With faces of despair, they speak the stories of pain, anguish, and fear. This is the fear of further disgrace, the fear of further rejection. Urinary incontinence is a disease where only women are accursed. Today, let's join hands and break free from this stigma and give these women a bright future, a future free from shame and isolation.